Welcome to the BCEN and Friends podcast, where we hold interesting conversations about learning with a range of thought leaders, BCEN certification holders, and industry professionals. Our goal is to create value and insight for you, our professional nurses across the emergency spectrum. We hope you find our discussions interesting, informative, sometimes funny, sometimes serious, and always worth your time.
In this podcast episode, we want to introduce you to our BCEN friend, Carol Tulley. From the halls of Cook County Hospital to her role as a trauma coordinator and educator, Carol's nursing career is all about leading, teaching, and creating a lasting impact. She will share advice on how to create momentum and build open roads of communication. This episode is called Creating a Legacy of Greenlights in Trauma Care.
I'm Holly Briggs, a professional development specialist at BCEN and one of your hosts for today. I'm joined by my co-host, Michael Dexter, Director of Professional Development at BCEN. Hi, Michael.
Hello, Holly.
It's great to have you with us. And in this episode, we're joined by Carol Tulley. With over 3 decades in emergency and trauma nursing, Carol has just about seen it all. And she's here to share her expertise, her stories, and a few pearls of wisdom along the way. I can't wait to dive in. So, Michael, could you please introduce us to our BCEN friend, Carol?
Yeah, I would be happy to. Dr. Carol Tulley has been an emergency nurse for over 30 years, starting out at the Cook County Trauma Unit in Chicago and now serving as the trauma coordinator at a level 2 trauma center in the western suburbs. Throughout her career, she's worn many hats, staff nurse, educator, and leader, but trauma has always been her true passion. She teaches and directs the Trauma Nurse Core course, holds several specialty certifications, including the TCRN, and has shared her expertise through presentations and posters at conferences across the country. Carol, welcome to the BCN and Friends podcast. It's great to have you with us.
Thanks, Michael, and thanks, Holly. Thanks for having me here today.
Yeah, absolutely. We're looking forward to chatting with you some more. And before we dive into a few different things, can you just tell us a little bit more about why you became a nurse and a little more about that journey and what led to your trauma coordinator role?
I could say that I knew from the time that I was 5 years old that I wanted to be a nurse. I grew up with, I think, Band-Aids in my little play purses when I was younger. And it just kind of led me to always want to care for people. So I think nursing is a calling, and I really felt that from the time that I was 5. Although I didn't become a nurse until later in life, I didn't think actually that I was smart enough to be a nurse. So I went down a different road and I served as a bookkeeper for a company for a while. And it was actually my boss at that company that said, you really need to think about fulfilling what you want to do. Really need to think about going back to school. And he kind of put that in my head. And that was back in 1990. And I looked into several programs. There was one in Chicago that was right by where I lived. It kind of worked out perfectly for me. So I went to Aurora University and I got my BSN. And I just remember it was so incredibly difficult to get that degree that as I walked across the stage, I made a promise to myself that someday I would go all the way and get my doctorate in nursing, which I just completed. So it's been a long road, but I will say that trauma was always a passion of mine. I mean, I grew up in the 70s watching Emergency and MASH, and I knew that that was where I wanted to be. They were great shows, and I watched them religiously. And I remember watching the news story about Cook County Trauma Unit. And I said to my teacher the next day in school, I want to work there. And he said, oh, that's really hard. And he probably won't be able to do that as a new grad. And I said, but that's the only place I want to work. So I really stuck to it. I kind of begged the manager there to give me a chance. And she did after I met with her and she hired me. So I can say I was one of the very first new grads that Cook County ever took. It was difficult, but it was amazing. And I loved going to work every day because I loved the fact that when you have a trauma patient, you really feel like you can do something and you can really help them. So I loved it. And trauma has always been always been my passion. And I was a staff nurse here when I first started. and a staff nurse for 18 years, at which point I became the educator of my department here in the emergency room. And then I had the opportunity to become the trauma coordinator as the position opened. And it was just kind of a progression for me. It was perfect. It was my dream job. It was something that I always wanted to do. And I just kind of slid right into that job, which is where I have been for the past 5 years, and I absolutely love it. So that's kind of the progression on what I did in my career.
Well, as the trauma coordinator job now, are you finding that some of your skills in bookkeeping originally that you started out with are helpful in your the PI data collection and these different things that have to be followed on?
Actually, yes, I use it a lot. I will admit that Excel was a little bit of a challenge for me in the beginning, but now we have become friends and I can use it a lot better. But yes, the answer to your question is yes, it did help me.
Well, I can completely understand that part of the Excel. We were never friends for many, many years. And now we're at least, I would say, mutual acquaintances. I would love to one day say that we're super friendly.
Yeah, I
But,
agree.
you know, just listening to you talk about, I knew at 5 I wanted to do it. And then I just had this feeling that I wasn't smart enough. That's the word that you use, or you just didn't feel like you would measure up to what needed to become a nurse. And then to hear you promise yourself, like, I am not only accomplishing this, but I am setting even a further goal. It's an amazing to hear someone who's been in their passion, who's devoted their life many years in the service of their community and nursing, the profession that both Michael and I are very obviously very passionate about that as well. But it's so comforting and it always inspires me to hear that. I can also hear very much that you are enthusiastic, passionate, devoted to the idea of trauma care. Clearly from your nursing career, you have certifications in it, you've done presentations on it. So yeah, I mean, you learned Excel for it. So there's a lot of that's a deep passion there. So just we could talk about what you've seen in the last 30 years, but that would probably take the entire podcast. So I guess I will ask to kind of maybe carve out a little time period. So, like in the past 5 years, what would you say that you've seen in trauma care as far as positive changes or improvements that you've seen in the way that we give care? And how have you seen that those changes are impacting our ultimate goal, which is patient outcomes?
There has been a lot of really great changes in the past 5 years, but actually, really over the past 25 years. When I started at Cook County, everybody that came in that was in a car accident got sent to the angio lab because they got an angiogram for blunt chest trauma, right? And that was crazy. Now that I think about it, it was crazy. Or if you had blunt abdominal trauma, everybody got a diagnostic peritoneal lavage, a DPL, right? And now we have these great like digital CAT scans that nobody needs to go to be angioed and nobody gets DPL'd anymore, which had its own set of complications that could arise from it. So that's been a great thing. But I would say probably in the past 5 years, the addition of TXA, transexamic acid, has just been phenomenal, especially for long transport times. So we have been giving that. I tell everybody it's when you have a stroke, they give you TPA to break it up. And trauma, we give you TXA to put it back together. So it's been really cool because we have been able to use that pre-hospital. So a lot of the patients that are coming in have already started to slow their bleeding down, which has been great. Aside from TXA, we take a lot of things from the military and trauma, and they kind of start all I say, the good stuff. I think the pendulum's going to kind of swing back again, and we're going to get away from blood components and get back into whole blood, which is really kind of cool because the military uses whole blood on the battlefield. And if you think about it, you have less chance of having a transfusion reaction because you're not using multiple different components from different donors. You are using one component from one donor. So that's been really cool to see the whole blood come back again. And just overall with and the diagnostic tools that we have that we never had before has been really improving patient outcomes. And one of the things that we're doing here at Central DuPage Hospital, we are now going to be giving antibiotics for any penetrating trauma or any open fractures in the ambulance on the way here. So they'll be getting 2 grams of Ancef before they even hit our door, which will really help to decrease any of those postoperative complications of sepsis or infection. So I think that's been really kind of a cool thing. And that's just starting now. So lots of good things coming down the way in the way of EMS and of hospital. So good to see that happening with trauma.
Carol, you've mentioned a lot of clinical things, which I think are great, like, the whole blood administration, antibiotics, and those things. But there's also been a lot of administrative changes too. Like the ACS has new standards that they're really pushing. There's pediatric readiness assessment that's been pushed for in trauma centers, geriatric protocols, mental health screenings. So how do you keep up with those kind of changes too? Because it seems I've downloaded the, is it resources for the optimal care, the gray book. Downloaded
Yeah.
some of those references, and it just seems to be so much. So how do you keep up with all of the clinical changes as well as all of these administrative things that they keep updating as well?
So that's a really good question, Michael. That's a really good question. And it is sometimes difficult to keep up with it. I think the pediatric readiness has been fantastic. I mean, pediatrics is an area that is really a specialty. And same thing with geriatrics. Actually, my doctoral project was on geriatric trauma. So I'm really passionate about both because I really think they're the same person 80 years apart. But it's hard to keep up with it, but we do have somebody here who keeps up with our EMSC and keeps me updated on any changes in trauma. We have the new, like you said, the optimal care of the injured patient. That is something that's kind of like a Bible to me. I look at it all the time. I stay on top of that. We have a great EMS coordinator here who keeps me updated on anything that's happening with in the EMS world. But it is difficult because it does change all the time, and then every state is different. Everybody kind of tweaks that a little bit to what works in their state. So it's just a matter of having the right people in the right places to help you stay updated on everything that you're doing. But yeah, I agree. There's a lot of changes. And a lot of changes in the past. I hate to say it because everybody talks about it, but since COVID, a lot of things have changed, but a lot of things have changed for the better. So it's always good to see new things coming out that does affect the outcomes of our patients. So
There's always changes. There's quite a few. It seems like they're so rapid. And we talked about the clinical and then the administrative. And I think something that's kind of in between there is this topic that we often hear about. But I think people still sometimes have a difficult time defining it and defining it in terms of clinical staff and even in terms of patients and family and their support systems. But that's the phrase trauma-informed care. And that really encompasses a different aspect of trauma. So how do you view trauma-informed care, and how do you view it in terms of not just the patient themselves, but the healthcare team and those that you're working with to ensure that you do have a good quality team caring for others?
yeah, that's a hard one. I have always said that ER nurses are the best. I mean, I am very biased. It's the only thing I've ever done. But the one thing that the ER nurses do not like to do is talk about their feelings. They like to just take care of a patient, no matter how bad it is, and then we just shove those feelings down and move on to the next patient. And when I was a new grad at Cook County, my preceptor said to me, don't feel anything because if you feel, you will burn out. So just keep moving. It was probably the worst advice I had ever received in my whole career because eventually that comes back to get you. And I think that's trauma informed care. I think it's the what happens to you and how you react to it is really how you can go on. And I think the patients have experienced it from their injuries alone and the care that they are provided and what they have to go through. But the healthcare team feels it as well. You have a small, like one of the patients that I took care of in the very beginning of my career was a 6-day-old that died. And I remember I couldn't even think straight for a while afterward, but I kept thinking, I'm not supposed to feel, I'm not supposed to feel. And that has stuck with me for a long time. That is trauma that when we get a phone call that we're getting a small child in, I can pull that back up because it's still there. So I urge our staff when this happens to talk about it. You have to talk about it. You have to find either your person at work, your family member, somebody who understands you, because you got to feel it and then you got to put it in its place. Because if you do that, you can keep going and you won't burn out. But if you say, oh, this is just a job, this is what we do, you're going to burn out because it's eventually going to catch up with you. So, trauma informed care is really not just the medical trauma, but the psychological trauma that everybody experiences, from patients to families to pre hospital providers to the healthcare team. Everybody feels it. And I think, again, you just have to understand, you have to let yourself feel it, and then you have to put it in its place. And that's really trauma informed care to me. But it's
Well,
probably one of the hardest things we do as ER nurses or ER healthcare providers.
I could not agree with more of not only what you experienced in that piece of advice that you got that you said was just the worst. Definitely have heard some similar tidbits of advice along my career in nursing. And sometimes especially when you're young in a career, I think you just kind of swallow things and you're like, they obviously have been here long enough. They must know what they're doing. And then it takes you a while to realize that, like, no, that wasn't a piece of advice that I should have taken to heart, because it really doesn't, to your point, it really doesn't work out. If anything, it promotes burnout, I think, quicker. When you talked about trauma-informed care, just that idea that trauma is not just what's wrong. It's something that happened, and it's something that's not only going to affect the patient, but it's going to have lasting effects upon everyone that is involved in that care, in that trauma, because we see that patients who have impacts physically that will last long after you're done giving them care in the ER or even in the hospital, but then also that their injury and their care impacts their family, impacts their loved ones, impacts the healthcare team and every person that touches their care. And I'm sure we could spend the rest of the podcast, you, me, and Michael, just swapping stories about patients whose brief moments with us, whether that be an hour, whether that be 10 to 15 minutes, whether that be hours upon hours, that they will stay with us long after we retire from nursing. And so that to me is what trauma informed care is, to say that it's not just this, hey, what's wrong with this patient? Wipe my hands, move along. It's no, like, something happened to a fellow human, and that happening is important, and that it's going to stick with us long after they've moved on from our care. So it certainly does require you to talk about your feelings, which I understand. I don't
Mhm.
always like to talk about mine, but I will say that given that I'm no longer that baby new grad who was told that, like, hey, you have to compartmentalize everything, otherwise you won't make it in this big
Right.
tough ER, I've grown to see that actually the ability to be vulnerable is a strength that nurses should applaud and try to grow in, versus cutting down those who maybe that's naturally their thing. And maybe we should help them want to stick around the ER to help us learn how to do better, be better. So, we could kind of
Yep.
stay on this, Carol. Like I said, we could swap stories and talk about it. And I
Hmm.
think even just talking about it on this podcast just opens up, hopefully, this idea that as nurses we can do better when it comes to this, for sure.
Hmm.
Um, I will say that we're excited that you have an upcoming session with us at Destin Learn Live. By the time this episode airs, it will have already taken place, because this question that I'm asking you will be kind of a spoiler alert. So we're not going to spoil anything. We're going to wait, but it is a very personal presentation for you. And so I guess if you could just tell us a brief high level view about what it's about? And then what is the takeaway that you really are hoping that attendees will walk away with?
First of all, I'm so grateful for BCN for allowing me to tell this story. This is a really deeply personal story. This is a story of my nephew, Ryan, who was involved in a pretty horrific, traumatic accident in March of 2023. He was critically injured, and as he was getting better, I told him, when you get better, we're going to tell your story to whoever will listen. So it was probably one of the most difficult times in my career because for 30 years, I made the phone call that your family has been involved in some sort of trauma and you need to come to the hospital. But this was the first time that it had been made to me. And being on the other side of that phone call was incredibly difficult. And I think that my family was looking at me to give them answers like, is he going to live? Is he going to be the same person? Ryan sustained multiple injuries. He had multiple brain bleeds. He had facial fractures. He had lumbar and spinal and sacral fractures. He had pelvic fractures. He had a 90% amputated leg. He had a lot of injuries. And they were looking to me to say, what's going to happen? And I, for the first time, I think in my career, didn't know medicine. I knew it, but I just couldn't separate the personal feelings from the medical knowledge that I held. And I remember reaching out to the trauma coordinator at Loyola, which is where he was at, and I was saying, you got to tell me what's happening because I don't know what to think or what to say. So it was really difficult for me. It was a difficult time, but I will say that he is 100% better and he's doing great. It's a great story, and I think if I had to pick one thing that I wanted the attendees to walk away with is that I want them to know that the care that you provide, it matters. It really matters. I think sometimes we just go from one patient to another to another. And again, we think this is our job, this is what we do. But being on the family side of it, I can tell you how much that means to the family. And one of the things I did after Ryan was hurt was I reached out to the paramedics that cared for him because I had to thank them. They put a tourniquet on his leg and they literally saved his life in those moments that it took from that tourniquet being placed to get to Loyola. And I wanted to thank them for the care they provided. And the one thing that I took away from the story was the medic said to me, we never know the ending. We never know what happens to the patient. And I thought about that as my own career. We don't know. We just take care of them, we save them, we send them out. And it made me realize how important it is to know the whole story and how the piece that you provided actually fit in to that story and how much it matters to the patients, to the families, on what you do every day. Like, never overlook your importance. You may have been a small piece when you took care of the patient, but that small piece made the whole story. And without what you did, he wouldn't be here today to talk about his story. So my last slide in my presentation is a picture of him a year later, and it says, what you do matters. And I think if I had to pick anything, because we could sit and talk about the medical aspects. Yeah, they put a rod in his leg, they did this, they did that. That's all the medical procedures, and those are super important. I'm not going to disregard that. But I think you need to realize that what you do matters. And that is what really, I mean, Ryan has said, the doctor saved my life, but the nurses saved my soul. They were the ones that got him through this incredibly difficult time in his life and our family's life as well. So it's been nice to be able to tell the whole story because I've had people come up to me after I've told the story and they say, I've never known the answers. I've never known what happened to my patient after they left. And it was so good to see the whole thing and to know that I do make a difference in somebody's life. So I think that's my biggest takeaway is you do make a big difference and you are so appreciated for what you do every day. So that's what I'm hoping that everybody takes away from it.
Well, I'm sure that they will, Carol. I love listening to you talk about it. And I started my healthcare career in the ER as well. And then I moved out and did some stuff in cardiology, which took me into critical care ICU areas quite a bit when we were dealing with some advanced heart failure things. And I tell people all the time, I enjoyed the ER and I continued to work there PRN, but I learned so much about the continuum of care of the patient that I just never realized when I was working in the emergency department. And the way that even the initial management and the way that I interacted, communicated with patients totally changed when I came back to the ER full time because I had just realized that there are so many valuable things that are often overlooked or so many loops that are never closed and I really wanted to work to do that. And I still have people that I took care of 10 and 15 years ago now that will text me or call me every once in a while just to let me know how they're doing. And there's just a lot of value in seeing the work that we do and how the long-term care that it brings, the long-term impact, I should say, that it brings to an individual is just very, very rewarding. And it is tough when you work a very long 12, 14-hour, 16-hour shift in the ED and then never know if what you did really mattered to people. And so coming back and closing that loop is super important. So I'm glad you're sharing that. I'm really excited about it and appreciate that a lot. And certainly his injury has impacted you as an individual, as an educator, as a clinician. And so, whether the answer is him or somebody else, we always like to ask this question on the podcast, and that is if you can tell us about a person or a moment in your career that greatly impacted you as a nurse and what that was.
I have a lot of them. I do have a lot of them over the 30 years I've been doing this, but one I think that sticks in my mind the most was when I was at county and it was a 26-year-old female that came in. She was involved in a car accident. Her boyfriend was driving. He had been drinking and they had a 2-year-old. They had 4 kids, but the 2-year-old was with them because the baby had a cold and the mom said, "You need to stay home with this baby. I'm not taking the baby. I'll take the other 3." And the boyfriend was wanting to go out that night. And so she agreed. And anyways, they got into a car accident on the way home. And the mom was in the back seat with the baby. And the mom was they hit a tree and the car was kind of smushed. And the mom was in the back seat and baby was okay. But the mom was kind of wedged between the car seat in front of her and the one that she was sitting on. And by the time they got her out, she was really critically injured. And when she came into me, I remember everybody wanted to take care of the baby and nobody wanted to take care of the mom because, she caused this, it was her fault, blah, blah, blah. So I took the mom and she was super sick. She had no blood flow in her lower extremities. She was pale. She looked terrible. I just had a feeling that this was not going to end well. You just know when you look at some patients that they're just not going to do well. And she kept saying to me over and over again, "I want to see my mom and my aunt. I want to say goodbye to them." I think she knew that she was going to die. And the docs were up in the OR with another case and they came down and they saw how bad she was. And they said, "Pack her up. We got to go. We got to go. We're going to intubate her. We're going to take her up to to surgery." And out of the corner of my eye, I saw 2 women standing at the window talking to our unit secretary and asking the secretary questions. Although I couldn't hear what they were saying, I just had a feeling this was the mom and the aunt. So I told the physician, "Nobody touches her. I need 2 minutes. I just need 2 minutes." So I ran and I got the mom and the aunt and I brought them over. And that's about all the time they had. And the daughter was able to hug them and say she was sorry. And they had just a couple moments together. And then they took her off to surgery and she never regained consciousness. So I think that that was a really impactful thing for me because it made me realize that it's not always just the medical that you are providing for a patient, but it's that psychological. And the family wrote me a letter afterward and they thanked me. And they said, because of you, we were able to say goodbye and we never would have been able to say goodbye. And we will remember that for the rest of our lives, that we got to talk to her that one last time. So it made me realize that nursing goes far beyond medical. You've got to mix the medical and the psychological together. And that is one story. I went to her funeral. It was horrible. Her boyfriend was arrested for vehicular homicide. It was just a really bad situation, but in the badness of it, the goodness prevailed, and that was that her family got to see her the one last time. So that story happened probably 30 years ago, and I can still close my eyes and see her face. So it's something that I'll probably carry with me forever, but in a happy way, that I was able to provide the one last wish that she had. So that's probably the one story that will stick with me forever.
Well, that's a pretty incredible story, Carol, and I'm really glad you shared it because I think it's something that a lot of nurses need to hear. And I think there's certainly times when speed helps, but I think there's also times when, in the speed of trying to work, we leave out things that are extremely harmful. And the fact that you were able to pause for just a moment and allow that was truly a remarkable opportunity for the family and for the individual. So, yeah, definitely. Thank you for sharing that. I'll turn it back over to Holly to ask you some lighter things, Holly.
I do get the chance to basically pivot this entire very somber moment, which I'm so grateful. Thank you for sharing that. And I appreciate you being willing to be vulnerable and call attention to something that really needs to be in the forefront of every nurse's mind when they go into work, is that you have the opportunity to create these moments that will last not only in your mind for a very long time, but in the minds of patients and their families, maybe for the rest of their life. And so I appreciate that. And this part of the podcast is like, okay, let's do some rapid fire questions. And it normally comes out of what is usually kind of like a somber moment. And so I don't know how better to do that other than to transition quickly. So I am going to get to ask you a few rapid fire questions. And again, they're just so we can get to know you a little bit better. I know you talked about bookkeeping beforehand. I'm not thinking you were going to pick this, but if you could, what would you be doing if you were not in your current role? Like, what is something, maybe a career you want to try?
Oh, that's easy. I would rescue every dog in the world. I love animals. And I would open the biggest shelter I could possibly afford and I would take them all in. That is what I'll do in my retirement, is I will go and I will volunteer at a shelter and I will just play with dogs all day.
Mm, okay. Well, Illinois is a little bit away from me, but as soon as you get that shelter up and running, I will come and cuddle some puppies and walk some dogs.
It's the
Yes.
best.
Yeah. Yeah, there is
It's
something.
not that I don't like cats, but I love dogs.
I like that too. I am a dog person. I do have a dog, but when I was a kid, I did have a cat and he was something. So, but yeah, and my best friend, she volunteers at a animal shelter in New Orleans, and it's not only a way for her to give back, but I think it also gives back to her. And yeah, so 100%. All right, I have some favorites coming at you. So, what is a favorite book or maybe a quote that just inspires you?
I love to read. So I love nonfiction though. And I just got through reading Matthew McConaughey's biography, Greenlights, which I thought was fantastic. Kristen Hanna, love anything from Kristen Hanna, but she needs to stop killing off the main characters. So difficult, but great books, great books. As for my favorite quote, I have two, and I have it on my wall right next to me. And it says, it's by Gandhi, and it says, be the change you wish to see in the world. Because it's so true. If you want something to change, be the change. be the person that's willing to do it. So that's one. And then the other one is the meaning of life is to find your gift. The purpose of life is to give it away. So find what you're good at and share it. So I love both of those.
I can see why. Those are some, not only some great recommendations, I will wholeheartedly agree with you about Kristen Hanna. Oh, that,
Every main character, she kills them off. Don't know why
and
she does that, but
I
they're
know. I know. When I pick up her books, I'm like, oh, let me see. Yeah, I'm gonna fall in love with this character, and they're definitely gonna die
that is
before the end.
correct.
Um,
And then they're gone. Mhm.
right. At least she's better than like George R. R. Martin because let me tell you, he just kills everybody.
Yeah.
So yeah, you gotta love an author that keeps you on your toes.
Yeah.
And then I love both of your quotes. Really, that second one too definitely keeps things into perspective. So thank you for sharing both of those. All right.
Mhm.
Favorite movie, TV show, or it can be a binge-worthy series because we're always up for one of those.
Well, I can tell you that I don't watch television. I don't even turn it on. I don't have cable. I don't watch it, but I do like The Pit because it is the most realistic ER show out there. So I have started binge watching that a little bit. I do like that one a lot. And that's about it. I don't really have a TV show to
Yeah.
read more than watching TV. So,
Carol, I wholeheartedly understand. I'm a big reader. My husband gets mildly frustrated with me, like a little frustrated, not a lot, because he's honestly, I've worn him down. But he'll have a show on and he'll look over and have my book open. He's like, "Are you watching this?" And I'm like, "Of course I am. I'm sub watching. I'm like watching it and reading." And then he'll be like, "So you're not watching it?"
there is one thing that I will watch every week, and that's football. I love football.
See, and that's also something that I can like sub watch. I can have because honestly, I don't, there are certain teams that I'm just like, I really root for, and I almost get too involved. When I feel my blood pressure going up, and I'm like, okay, I need to get a book because I'm too
Yeah,
invested. I'm too invested in the outcome.
yeah, I hear you. I
I gotta
hear
pull
you.
back a little bit, but I like a good game. Yeah. All right. Favorite song, musical artist, something that can just instantly move you.
Lauren Daigle. I love Lauren Daigle. She's a Christian artist. Lauren Daigle is my girl. Anything she sings moves me. I love her.
I mean, let's prop up a Louisiana native a little bit more, okay? Because my girl, yeah, bringing it. She has the tone of her voice.
Oh,
I really
love
like
her.
the tone of her voice. I mean, not only do I appreciate what she writes about, and I mean, honestly, just kind of as a person, I followed some of what she's done and said, but I even just musically, the
Yes.
tone of her voice is so unique and so different, so well-rounded. So, yeah, I'm 100% with you. And like I said, go Louisiana. We did something good. Okay. This is a good question because honestly, it follows along with when you're keeping a full schedule, a full life, full all of the things, it's important that you kind of intentionally prioritize self-care. So, my question to you is, do you have a self-care go-to or a way that helps you reset?
I do. I love to walk. It clears my head. It's a time I can spend alone. I usually take my dog, but it's time I can spend alone to process things, process what happened during the day, help me to sort things out in my head, especially if I have a full day the next day at work. I'd love to just get out and walk. Even if it's cold outside, I'll get out and walk. I love to go to the gym. I like to elliptical off my frustrations. So I do like to go to the gym. And lastly, I will get on any plane that is going anywhere with a palm tree. So I love to travel. Love to travel.
Those are some good ones. A good walk, a good session at the gym, and of course, a good little tropical getaway where the sun and the
Absolutely.
sand meet. Yeah,
Hmm.
not a bad way to reset. Well, thank you for sharing all that. If our audience would want to follow you online, are there social media platforms that they could follow you on?
Yeah, I am on Facebook, I'm on Instagram, and I am on LinkedIn, and that's about all I can keep up with.
Honestly, that's more than most. So good for you. And I will put the links for your profiles in the blog for this episode. So thank you for sharing all that.
Thanks for having me here. I really appreciate it. It's been great to talk to both of you.
No, it's been really good talking with you, Carol, and I enjoy hearing from your perspective and obviously the expertise that you bring in trauma care and really the patient and clinician interaction, I think is just a great conversation to have and being able to not only focus on the interaction, but focus on the long-term impact that that interaction has are really great things to discuss. And it's something that Holly and I are both very passionate about as well. So it's been great having you on here and getting to know you some more. And even though, as Holly said, this will come out after the conference, I can say at this point in time, I'm very excited about your presentation and excited for all those that attend and hopefully many others that can maybe watch it on demand later on once the video is available. But would love to be able to help spread the message to as many nurses as we can that you're sharing. So thank you for that.
Thank you. Thank you both.
Well, I want to take this time to thank Carol for joining us for this episode of BCN and Friends. Carol, thank you for reminding us that it takes passion, dedication, and expertise to care for patients in their most critical moments. And we appreciate you sharing your knowledge and insight with us today and for the impact you continue to make in the trauma community. And to all of our listeners, stay tuned as we bring new, insightful episodes of BCN and Friends. If you have an episode suggestion, we'd love to hear from you. You can send us a message to bcn@bcn.org. I'm Holly Briggs here with Michael Dexter, and on behalf of the entire BCN team, we thank and celebrate you for all that you're doing as professional nurses across the emergency spectrum. Until next time, we are out.